I think we're going to push on. It's just after 2, and as I said, there's a lot that we want to cover in the event this afternoon. So we'll just get started. There's some more people kind of coming into the event, but we'll kind of let them in as they kind of log in and join in. So afternoon, everybody. We're delighted that we've got so many people who are signed up for the event today. We're really excited about having the opportunity to kind of share the information and the experiences of the Infant Parent Support Project that's kind of located here in Ballymun. So I suppose my name is Laura O'Reilly. I'm the coordinator of the Urrus Training Centre, which is within the Ballymun Youth Action Project. And my role today is essentially to open the event, to introduce speakers and to attempt to try and combine the questions that are coming through the event and to put those questions to the panelists today. So you can see on the panel we have a panel of speakers kind of with us for the event this afternoon. We have Vera Hughes, who is the Infant Parent Support Coordinator, and Mary Fitzpatrick, who's the Infant Parent Advocate Worker with the Infant Parent Support Project itself. We have Justin Gleeson, and Justin is the Clinical Midwife Specialist in Addiction for the HSC, linked with the Rotunda Hospital. And we have Ann Lyons, Infant Mental Health Coordinator with youngballymun. And we also have Hugh Greaves, Coordinator of the Ballymun Local Drug Task Force. So that's kind of who we've got speaking today. I suppose the purpose of today is really an opportunity for us to provide an overview of the really exciting work of the Infant Parent Support Project. In order to do this, Vera and Mary will provide us with a description of the project along with some insights into the project outcomes and the learnings that we've gained from the project over the last number of years. And in addition to hearing about the Infant Parent Support Project itself from both Vera and Mary, we're also taking the opportunity this afternoon to describe the interagency work that supports the delivery of the project, namely through Justin as the Clinical Midwife Specialist and also with youngballymun represented today by Ann. But we'll also have an opportunity to also hear how the Infant Parent Support Programme actually through that interagency work supports other service delivery to parents and to infants and toddlers in the Ballymun area. As we kind of move from one speaker to the next, at the end of each panelist having had an opportunity to share their experience of the programme and the interagency work, we will have an opportunity for questions and answers. So what I'd ask people to do is, you can see down the bottom of your screen, there is a Q&A function, that any questions that you have as you're hearing the panelists talking, you can log your questions into that function there, and I'll be keeping an eye on them as we move through the afternoon, and then we'll take as many questions as we can before we wrap up, and we'll put those to the panelists. And then our closing remarks will be from Hugh Greaves, as I said, Coordinator of the Ballymun Local Drug Task Force. So before I move into, I suppose, into the description and the overview of the Infant Parent Support Programme, I'm just going to take a couple of minutes to just give a little bit of kind of background and context to where the project originally came from. So it was in 2012 that it was recognised that there was a reduction in the level of service provision to mothers and children from birth to 2 years who are living in the Ballymun area. And there was also a growing awareness in the community through the Ballymun Network for Assisting Children and Young People and the Ballymun Drug Task Force that there was two kind of key challenges that were, I suppose, being identified. Firstly, it was being recognised by services that they were experiencing challenges and difficulties accessing parents who were using substances, but who were parents of babies and toddlers. And secondly, it was recognised that the parents themselves who had experience of substance use, that they themselves found it difficult to access statutory services. So there was a gap, I suppose, in being able to kind of link mothers and fathers as well with young babies and toddlers who also had substance use issues into the appropriate services for children and for them themselves in terms of their substance use. So with those issues being raised, it was recognised that there was mothers with babies up to 2 years in the Ballymun area who were in some way being impacted by substance use, and also that there was a growing appreciation of the significance of interventions at the earliest possible stage in a child's life. particularly, I suppose, the role that can be played around supporting infant mental health. And I know both Vera and Julianne will speak to that kind of topic a little bit further kind of later in the event this afternoon. So because of those challenges, because of those difficulties and those gaps within Ballymun, it was identified that what was needed was a specific response to target that particular population. So from there, it was there was a sense of in 2012 that a response needed to be put in place, and quite promptly. And I suppose what emerged from that was the development of the Infant Parent Support Project. Initially, when the project was set up, there was one practitioner, the Infant Parent Support Coordinator, who we all know as Vera. But within 2 to 3 years of the project being in operation, around 2015, it became really clear that additional support was needed around that project, both in terms of the number of days available to the service, but also in terms of the staffing of the project. So the project was initially set up as a 4-day-week service, that increased to a 5-day-week service, and it also then resulted in not just Vera as the Infant Parent Support Coordinator, but in addition to the team in the form of Mary as the Infant Parent Advocate Worker. And again, they'll both talk to the different roles that they hold as part of the project. So you can see on the slides there that we have in front of you is that broadly speaking, the Infant Parent Support Programme, it aims to meet the needs of parents during pregnancy and through the early formative childhood years, where there are issues related to problematic drug and alcohol use, with the objective being to increase the well-being of parents and infants. The project itself, it's based in and it's project managed by the Ballymun Youth Action Project, with a review and a consultant group in place, which is represented by the Ballymun Local Drug Task Force, Hugh Greaves, Justin Gleeson as the liaison midwife with the HSC Addiction Service, Mary Fanning from Young Ballymun, and Dermot King, the director of the Ballymun Youth Action Project. The project is interim funded by the Drugs Task Force here in Ballymun through the HSC. So that's a very a brief snapshot of where the project has originated from, and how it's developed since 2012.